Good morning, Guam, and thanks for starting your day the KUAM way. Of course, starting lineup and really a lot to unpack as it has escalated rather quickly, starting with a press conference yesterday at 6 p.m. and the governor's announcement that COVID-19 is officially on Guam. Three residents have tested positive for the virus. And then from there, Sabrina, we got the announcement that they were going to meet about school closures today, but that ended up happening late last night.
Right,
and
3 o'clock in the morning, we got the press release, and
yeah.
another special address from the
Right,
governor
and
announcing
so
closures.
the 3 o'clock press release, of course, 2-week government shutdown, public schools also closed for 2 weeks, and just a slew of closures, and I think that's what people are waking up to this morning.
Right, and I think, just reading that press release and listening to the special address, the announcement of the closures came following the discovery or further investigation that at least two of the individuals that they said came from the Philippines or visited the Philippines actually came in on February 29th, as
Right.
opposed to March 2nd, which was announced during the press conference at 6:10. So,
Yeah, and that was a little unnerving. Timely, accurate information is it's what timely we can understand because there's a lot going on, but definitely getting accurate information out there the first time and giving the governor the best info and the correct info so that she doesn't have to go out and double back. You know what I mean? And that's kind of what I think it just makes people kind of question and maybe lose faith in the government at a time when they should have full confidence.
right, and you.
Yeah,
go
I
ahead.
think our worst fears were realized, and that the virus is here. What a lot of people had speculated, and now we know that it's been here since February 29th at the minimum, right? So that's at least 2 weeks. So now we move from prevention to containment. And what is the plan for containing this?
Right.
Do we close off our borders? Do we have the authority to do that? Like I used the example talking to Sean earlier about what Manila is doing. They actually have closed that city off. They brought out the army. You can't go in and you can't come out. You can travel within the city, but they're closing it off for a 30-day period to find out who has the virus and to treat those, identify, and then you have an additional 2-week period in which to further contain it. And I don't know at this point. I think they're meeting, GovGuam is meeting right now to decide what action to take, but we're definitely in containment mode as
Right.
opposed to prevention mode, because it is here.
And with us is Sean Gumatao. He's a former colleague here at KUM, but also he was the former Joint Information Officer, the head of the JIC during the Camacho Cruz and Camacho Moylan administration, and he also helped craft the pandemic response plan in 2010, and I guess the revisions in 2016.
At least seeing it from the outside looking in, and it's funny I'm here with you guys talking about in the very beginning of your day. Haven't done it like, I don't know, let's say 17 years, so it's kind of cool to be in the mix here with you all to talk about it, but it's a big deal with what's happening, and Nestor's absolutely right that it's already here, and we had talked about this before just over the
Right.
weekend. Timing is everything. And also about the communication out to the community, and I've said it, like I said it last week with you, I'm not going to beat them up over it, but the community absolutely needed to know a little sooner than just last night at 6 p.m. They should have been. It should have been maybe Friday last week, maybe even at the beginning of the week, because the other states and territories are already ramping up. And I'm not saying that we were last, because we're definitely not the last of the Mohicans right now.
Yeah.
But as to Nestor's point, we're already past it. That I'm not so much concerned about the two that came from Manila as much as the third one
Yeah.
that happens.
No travel
no
history.
travel whatsoever. And I think as a community, we should be absolutely concerned about that news.
Yeah, and
Because
with
it's
the
been here for a while.
information, I mean, you talk about timely information. We weren't even told that there were
PUIs.
3 PUIs who were tested. So this was a major nuclear bomb drop for us to find out at 6 p.m. that 3 people were tested and that they were confirmed positive when we didn't even know that they
we
had been
it,
rounded up
right.
on
And
Saturday.
I think that was the thing I asked, like, were they surveillance cases or were they PUIs? Because that criteria came out Friday or Thursday night.
It's confusing.
Thursday night, maybe.
Right.
And so to hear, you're right, to hear that they were PUIs and the press releases we had received on Saturday, there was no indication that we had any PUIs. It
Right.
was just no confirmed cases.
I
And
actually
then
remember
Sunday,
seeing the press release Saturday night and thinking, oh, a sigh of relief, like, okay, no one was brought in, no one was tested. We can kind of breathe. easy. And, you know, I was blindsided. I think we all were.
And I think even to your point too, is also the question was asked about their engagement with the federal government, especially the Centers for Disease Control, which part of their pandemic plan calls for that immediate engagement. The lead agency is public health in these matters. I think you know, right now they're almost they're on the bench right now for the most part, because if Homeland Security is running most of the effort, they're just really they got to kind of stick to the fidelity of their plan. And I think if you look at it down the road, it's important that they continue to do it, because the resources will get pretty thin if this thing goes beyond anything beyond 2 weeks. 30 days is going to stretch it, and then you're going to really tension it in 2 months. And so if they can keep to the fidelity of their own plan, the community should feel a little bit more comfortable knowing, hey, there is a plan, but not one that they just tossed out because of the ever-changing times. We don't expect, you know, plans can be moved around, and they spent a whole workshop last week on it, but that plan, it'll take weeks to update it based on that meeting.
Yeah, we're still waiting for that plan. We asked about it last week.
But that's why you have a
Right.
2016
Still waiting
plan.
for a lot of stuff.
No, but the
Yeah.
2016 plan, that's what drives it now.
Sure.
And that's what drove GRMC early on when they first presented.
Right, Dr. Mike Cruz?
He helped write it.
Yeah.
Yeah.
And so he was saying, I'm following the plan.
Right.
And so please let it do its thing. And I think that's a criticism by the medical society too.
Right, the Guam Medical Association,
Association,
just this morning, actually, since yesterday, I've been in communication with Dr. Shea, and he's been the one proposing that we just lock down the island. And so they are anticipating to hold a press conference sometime today. They want to provide input to the community, share, you know, their knowledge, because from what I understand, there hasn't been any real
communication, right?
with
So
the private physicians.
sure. And I
with,
talked
Adelaide.
with Dr. Wen on Friday, and he had said that, the governor had made a big to-do that she had met with physicians to craft that physician's alert, and he said, well, she didn't meet with the top 3 clinics. So, and that, to me, what's really alarming is if you just listen from the get-go to what the physicians are saying, the people who are actually going to be on the front lines, I mean, more so than the governor is going to be, they've been pretty consistent. They've been saying we're not doing any testing at a time when everybody was doing testing. And, you know, I mean, I don't want to say it's water under the bridge, but they've been pretty consistent in their message that Guam hasn't done enough, and that they haven't sought the advice of these doctors. And now we're at this point where you got the governor saying one thing, and you got the doctors saying a whole other thing. So, I mean, I really hope that they can get a seat at the table together and figure this out.
And just real quickly, I know that people are speaking to us on Facebook, asking and posting their concerns about wanting to know what village the people that tested positive are from. And that question was posed during the press conference, if they could just at least let the public know, but that information was not released. So
Yeah, Sean, I mean, in your experience, are they allowed to tell people that, or is that something, does I feel like they kind of use the HIPAA justification?
I mean, if they could say Northern Guam, you know, not give a precise village.
Right.
I think it would have been easier to say, if they knew, say if it was a certain village, you can use Central, Northern. At this point, based on the information you have, it's Central Guam because they're at the hospital.
Right.
I mean, so we don't have any other reason to think it's anywhere else.
And I think that when we don't get the information from the government, what ends up happening is people start idle time. You know, I was out interviewing people this morning, and there are
Right.
people up north in Jigo who are saying that, we're hearing that the 2 cases are from Jigo, they're Jigo residents. So I think if the government doesn't give us information to work with, then people start freaking out because they don't have any, you know, they're in the dark. And that's kind of what's happening this morning.
let's go ahead and roll that interview with when you were out on the street
Yeah,
this
it's a little
morning.
bit of a rough cut, guys.
Right.
You know, I was on the fly, so
But yeah, he was talking to people as they were shopping and preparing.
yeah. So
now.
I just went around kind of asking people what they're buying, what are their thoughts on it, and you know, I think with this pandemic response locally, people kind of understand that. I mean, this is a lot more. We've been, you know, it's a lot to deal with, and that's kind of the sentiment with the people that I was able to talk to. I mean, only a few. They're saying, "Hey, we feel like the government is doing the best they can, but obviously, there's a lot that needs to be done."
Yeah, there's a lot of fear and anxiety out there. I've got a call into Guam Behavioral Health Center.
Okay.
I'm asking if we can speak to maybe one of their psychologists to give us some advice for people out there who you know, are feeling that fear and anxiety, because there is definitely a lot of it out there.
Let's go ahead and roll that video.
So what did you buy in there?
Tissue, water, paper towels, bread,
Is this in anticipation
canned
of,
food.
so why are you out here buying? Are you worried that we're gonna run out of these supplies?
No, I just don't want to go to the store. Avoid being with other people.
And what do you think of the line in there?
Not so bad. Or now.
For now,
Still
no.
early. Yeah.
Tell me, what do you think of the government of Guam's response in handling this coronavirus?
I think they're handling really well. Yeah, alerting people to stay at home and stay safe.
How about you? Is that what you're gonna be doing?
Yes, that's what I'm going to be doing.
Okay, thank you. The response in handling this virus and the outbreak.
Well, I think they're trying their best, and at least they're controlling the crowds, like they're closing down the school like that, or whatever they're doing to the public to avoid crowds, and people won't get hurt or catch the coronavirus that's faster than being single at home.
What about elderly people? These are people who are very vulnerable to this disease.
Well, they're more easy to get sick because they're at that age, they're senior citizen already, and I'm probably one of them, so I don't know.
What's your name, sir?
Vincent Mangloni,
Vincent Magloria? What village?
Dedito.
There you go. Thank you, boss.
Is what I heard, like the two Filipinos from Jigo. That's what I heard. They live in Jigo.
So where'd you hear that from?
I think my son saw it in the internet.
If they are from Jigo or whatever village, that the residents should be told so that they can better prepare?
Oh, because usually if you don't really find out right away when you get sick, right? So you go wherever you go.
Look, if the flight was on February 29th, that means they've been on Guam.
Yeah, for like how many days already, and then the symptoms is just like they have that one is already 14 days. So for that 14 days, we never know that you already transmitted to the other person, that they spread already that very quickly of the virus. So it's better to be safe.
Thank you. Okay.
We're kind of worried because it's the island is very small, and you can only find out within 14 days if you're what you call this, if
Get with
you're
the virus.
yeah, with the virus, and that's why it's better to to prevent than and then I'm not sure about the facility if we're ready. I don't think that everyone is ready for this situation, so it's better to prevent than to have it with you.
Ma'am, so you guys were in here buying some supplies. What kind of things were you buying?
It's just all the food and then our necessities that we really use for our at home, and then for our medicine. What else?
Canned goods just in case.
Canned goods just in case you have lockdown or whatever.
Yeah.
Is what just what I heard about it. If there's lockdowns, no one comes in, or like shipments or anything like that.
So what do you guys think about the government of Guam's response on the coronavirus?
I think they're doing good. They're doing their their best, to prevent, because everyone's not ready about this kind of this virus. Even other countries, I believe. So
So you don't blame them?
Oh, you cannot
yes,
blame
you
anyone
can.
of this situation. This is a virus that really spread quickly.
This is what you call it. The world is not just Guam. Yeah.
Can I get your name?
My name is Jordan Dilambaka.
Jordan
Dilambaka.
How do you spell that?
Delambdaca.
And your name, ma'am?
Vanji Dilambaka. Vanji.
Vanji. Okay, thank you. What village you guys live in?
Jigo.
Here you go. Thank you.
Thank you, sir. I'm thinking to just stay home with the kids.
about if the coronavirus is spread around in Guam and everybody will get sick.
Yep, hey, I still don't get the toilet paper thing, but, you know, when I went around to a few stores, and that was probably the number one thing, people were buying, yeah, it's a lot of toilet paper.
We tried getting emergency, yesterday I was with Jason, we were shopping before any of this all broke out before the press conference, so I was like, I'm just gonna go ahead and prepare.
Right.
So I started looking for emergency, airborne, and it was gone.
Right.
Couldn't believe it.
And that's so talking Mike Benito, that's, what, people were focused on hand sanitizers, toilet paper, paper towels, Clorox, Lysol, but, then he said also, they're getting low on, you know, cold medicines,
Yeah.
flu medicines, just a lot of medicines, so.
I picked some up yesterday.
Yeah, so you're like, Bria's the hoarder, she's like hoarding for zombie apocalypse on a regular day.
I
so
know,
she-
that's not hoarding, it's just being prepared. We're
Right,
supposed to
right,
be
yeah.
prepared.
On any other day, it's
There's a
hoarding.
psychology of panic buying. That's really what's going on.
Well, speaking of that whole idea of the whole psychology of it, so the worried well is probably, you know, over the next couple of weeks we're going to see presenting at GMH and all across the island clinics, because they're gonna watch this, or they're gonna read the newspaper, or whatever they're gonna be doing, and they're gonna be saying, oh, I might have it. And this idea of either being symptomatic or not,
Right.
but the worried well, they're gonna, I mean, and we talk about all the time in planning, especially in government planning, at this level, those are the guys who may come first. You might have people who call and be ambulatory get there, but right behind them, there'll be much more people who are the worried well they'll be presenting to the
Right,
clinics.
yeah, and I mean, you know, we're just, if people are hearing that and they're saying that, then it's definitely out there, that's what kind of people we're talking about, is it my village, is it my neighbor, and, you know, that's to be expected when a big announcement like that is made.
We do have somebody who's asking, and Sean, maybe you can help just to kind of explain it to everybody. What exactly is self-quarantine? What should people be doing? It's just a question on Facebook.
Well, I had some family who came back from a trip. They didn't weren't near any affected areas. They chose when they got home. They went straight home, and they're committing to not leaving their home for a couple weeks. They'll be probably doing work from home. They've already reached out to their employer, but much of what they'll be doing, their activities will remain in their home, and I think it's way more comfortable than they'd be home, and that's been kind of the talk all across the country. Is this you know, the self or home quarantine is way more comfortable to do it at home.
Sure.
They don't have to worry about, you know, anything else. They have all their stuff at their fingertips. They don't have to worry about being, you know, away from their families.
I just gotta play devil's advocate here and say, I mean, self-quarantine, I mean, is that good enough when you don't have, you know, the medical professionals involved? And I know we can't put every single person in isolation.
Well, the system will get stressed very fast
Right,
if
right,
everyone
right.
starts coming down.
Right,
And
so that's why I think when people ask, how do you self-quarantine, maybe we should have an FAQ about what to do, what not to do, how
well, there's
extreme
a briefing coming up in
Right.
a couple hours. You might ask
Well,
them,
there you go,
can you
right,
help
yeah.
us with the
There
maybe
is?
guidelines?
Right.
Yeah.
And they continue to put out the tips, though. I mean, you know, it's not like, you know, you walk close to someone who has it and then you're going to get it. I mean, it's if you actually are touched or you breathe, but wash your hands and don't
Exactly.
touch
Your
you know,
face.
because if you touch your face and this,
Of course,
you
yeah.
touch something.
I
That's
just being
how
Guam,
you-
we're
how
so
you get it.
social. I mean, I could imagine someone being on 2 weeks self quarantine, and then people come in and oh, never mind, come in. You know what I mean? And so,
Yeah, so just real quickly, if you haven't heard yet, the governor ordered a 14-day suspension of non-critical government agencies, the Department of Education. All classes have been suspended until further notice, as well as all private Catholic schools. We're slowly getting more information about other private schools, but at this point, we know for sure that all Catholic schools have been suspended at this point.
right, Sean. So we were talking. I mean, I think everyone's talking about it. Yesterday it was about school closures. Now that's a done deal. What about grounding flights? There's a lot of talk about whether or not the governor has the authority to stop flights from coming in or leaving.
Well, I mean, I think from the press conference last night, you can tell that there's no engagement with the federal government, with the CDC. That what makes us think that she'll be able to tell the federal government you cannot land. Now, the FAA obviously drives a lot of that with a lot of help from DOT and the president. So at this point, unless there's some major travel ban, flights will still continue to come into Guam. We've already heard where the affected areas are now. They've already shut it down already, and so they're not flying. And airlines have already stop those routes.
Right.
And they diverted planes to those other routes that they needed help on. But the governor does not have that authority under the Organic Act to be able to just stop flights from coming in. Now, how we manage the borders are a bit different. Now, I didn't say flights, but when they get into Guam, that's a big difference. And
Yeah, and even just effective today, the Department of Defense, they put out another advisory
Right.
that all travel has been prohibited. So we're not going to see any military.
Yeah, and you gotta kind of wonder, I mean, usually the military's ahead of the curve, so if they're doing this, I mean, it's all speculative,
went
but
into
is
effect
something
today.
else gonna follow?
Yeah.
Yeah. I'd like to hear a lot more about the government's plans for containment, because I think that at this point, that's the key. The sooner we can contain this and you know, kind of give the all clear, the better off we are going to be, and the better off, the sooner we'll be able to get back to, you know, business as normal, or whatever that's going to be. But yeah, I'd like to hear a lot more from the government, and I'm sure that hopefully they're discussing it right now. How we plan to, what is our plan for containment?
yeah, and yeah, containment's a big deal, but also from the economy is going to it's taking it huge hits right now, and so we definitely can't keep staving off 2 weeks. I mean, just because when they're closed, there's still business activity, but we can't even, you know, as a small business owner with my small business, I mean, I can't go in and pay my taxes. I can't go in there and making sure that things are getting paid for. That doesn't make any practical sense. They need to help us to understand that, because everyone else is going to continue to work. I came from a business early this morning. They're shutting down at lunchtime.
Right.
A little concerned about not so much the business, but their children. And so we know that after today and the next couple days, we figure out what to do with our kids who are of school age, then other parts of it will be impacted. And we'll definitely see the impacts of that
And
too.
speaking of children, with the Department of Education shutting down, there was the concerns about, what about the children that rely on that meal
Yeah.
when they go to school?
This is
And
something we've been talking about. I mean, Guam is it's a poverty zone. I forget the technical term for it, but every child who goes to public school in Guam is able to get free meals because we have a lot of poor people here. And Speaker Barnes said, I think she wrote a letter.
Letter
I don't know.
Friday.
Right, on Friday. And so I know there was some talk about possibly doing a pickup service or what. So I mean, I think it's important, but I don't know what DOE's doing. That's something we'll probably look into.
Yeah, and I think other school districts across the country
They've
are
been doing that
now.
Right.
And you're absolutely right, Chris. I mean, a lot of the kids all around, they rely on those meals. That might be
Right.
the only meal they get for the whole day.
And they hear that all the time.
Yeah.
Well, this is a constantly evolving story, and we're going to try and get you the very latest information as soon as we get it. But the very latest that we do have is the special address, and we're going to leave you with that the governor and Adelaide provided to us at 3 o'clock this morning. So, thanks for watching.
Be safe, Guam.
Wash your hands.
Good morning. Last night, I announced that we received our first confirmed cases of COVID-19. Each of these 3 patients presented to GMH on Saturday and were isolated pending the outcome of their respective test results. Each patient remains in isolation, and Public Health has since initiated its close contact and tracing investigation. Because I want to give public health officials and our CDC advisors the best chance at investigating and mitigating against the spread of COVID-19, I am ordering a 14-day suspension of all non-essential government services effective immediately. All critical health and public safety operations will continue uninterrupted. This 14-day shutdown includes schools and all other government agencies. Directors will advise government employees if they are required to report for essential government operations. While our public health officials are doing their job to detect and track any potential spread of COVID-19, I am asking that we, as a community, take actions to make that task easier. We can do this by taking steps to prevent further transmission. By now, you have likely heard the term social distancing quite a bit. This practice includes maintaining a distance of between 6 and 10 feet from the next person when you are out in public. Please practice social distancing. It is imperative to our community's health. Additionally, on the recommendation of CDC and local public health officials, I am prohibiting large gatherings of 100 people or more. This prohibition includes social, school, sports, and religious gatherings. Detailed guidance on this prohibition will be provided in the next few hours. I know that many of you have questions. Shortly, the Joint Information Center will be announcing the establishment of a hotline intended to address your concerns as best we can. Additionally, other guidance as it becomes available will be provided by the Joint Information Center. I do not take this action lightly. I do it knowing that it will temporarily but significantly affect our way of life. But protecting you and your families is my first responsibility. I know that many of you feel a sense of fear, but you are our most effective weapon against this virus. Equip yourself with information. Stay home if you are sick. Avoid close contact with those who are ill. If you need to go to the grocery store, the pharmacy, or a medical facility, do that. But know that limiting your contact with those who might be ill is how you can help the doctors, nurses, and first responders who are keeping us safe. As I have said in the past, the situation is developing in real time. We share the information we have as quickly and accurately as we can. But sometimes that information may change as details are investigated and verified. For example, after further vetting and investigation, we have determined that 2 of the individuals who have received positive COVID-19 results actually arrived on Guam on February 29 and not March 2nd as previously reported. We are in the midst of a global challenge. Many countries around the world, 49 states and the District of Columbia, all have confirmed COVID cases. We are not alone, and I am taking these actions now to protect our community as a whole.